Imagine you've got an emergency. Maybe someone you love is having a mental health crisis. Maybe you see someone in distress on the highway. Maybe you hear a disturbance in your neighborhood. From a young age, we're taught to call 911. But do you really know what happens after that?
911, what's your emergency?
If you're calling from a cell phone, your call pings off the nearest cell towers and goes to the nearest 911 call center. In St. Louis, those call centers are housed in police departments. When a call taker answers, they'll ask where you are so they can confirm where to send help and make sure you're in their jurisdiction. But wait, why wouldn't you be in their jurisdiction if your call pinged the tower nearest to them? First off, because the current 911 system wasn't built for today's cell or Wi-Fi technology. But locally, it's also because the St. Louis region is super fragmented, with close to 90 municipalities. St. Louis County PD provides 911 services for about 40 of those municipalities. St. Anne PD covers another 12 or so. West Central Dispatch works with 8. A handful of municipalities have their own 911 service. You get the idea. This fragmentation means the call taker may need to hand you off as crucial seconds or even minutes tick by. So you're finally talking to the right 911 call center. Now what? The call taker will ask questions about your emergency and translate their notes into codes to quickly tell the first responders what to expect when they arrive on the scene. And the questions can change based on the call center, call taker, and how each center trains its staff. And codes can differ from call center to call center too. If the call taker determines you need an ambulance or a firefighter, they have to route you to the fire department dispatcher. Since 911 call centers are housed in police departments, other first responder services are usually fielded through a separate system. Another thing that might slow response time is capacity. Local call takers and dispatchers tell us there aren't enough staff to answer 911 calls, and that their shifts can last up to 12 hours or more. The fragmentation, inconsistency, and strain help explain why 911 call response times can vary from almost immediate to, well, DoorDash might get there first. Now, what if the call involves a mental health crisis? Or you're calling about something suspicious, but nobody's in danger? For mental health emergencies, the call taker might call fire or EMS to respond, but usually they send a police officer who may or may not be fully trained to handle mental health crises. Too often, 911 calls result in an armed police officer being sent to the scene, regardless of what each individual caller needs. Is that the right response? Through Ferguson partnered with Datalytics to analyze more than 1.7 million 911 calls made to St. Louis County Police from 2015 to 2020. Our research found that the vast majority of calls to 911 in St. Louis County are not for major crimes. Most of those calls don't need armed police to show up, but almost 100% of the time, that's the default response. So how has 911 become synonymous with police? Well, many people assume 911 was created simply as an emergency response system. But 911 as we know it didn't even exist until the late 60s. Civil rights movements were sweeping the country, and 911 was created to help suppress Black and brown uprisings against segregation and police brutality. But lately, as budgets for social services and safety net programs have shrunk, budgets for policing and incarceration have generally grown. This puts the burden on police to provide vital social services they're not trained or equipped for. In other words, our policy and budgeting decisions have created a 911 system that was designed not for care, but for control. And we've seen it used that way, particularly in predominantly white communities where folks use 911 as a customer service line and use it to call in the mere presence of a person of color they think doesn't belong in their neighborhood. Those calls often result in tragic interactions between people and police. There are too many examples where the arrival of an armed police officer ends in tragedy, trauma, and reinforced mistrust of our public safety system, particularly when those calls involve communities of color. So it's time for St. Louis to join national movements toward community-based safety responses. That's why Through Ferguson is introducing Transforming 911, a community accountability and advocacy tool that examines St. Louis's 911 system and serves as a call to reimagine public safety. Because the 911 system we have isn't working for anyone. It's not working for call takers and dispatchers. It's not working for the police. It's not working for all the St. Louisans who have to use 911 to access our public safety system. But it doesn't have to be that way. People built this system, and that means we can build a better system that centers community and care. To learn more and get involved, visit transforming911.org.